This section provides practical cautions regarding oxygen pulse therapy. Oxygen is safe unless it is abused or overused. Harm is possible, but far beyond the recommended use described in this presentation. There are several cautions about oxygen use. Breathing pure oxygen for 12 or more hours can harm the lungs. Prolonged use of rich oxygen for weeks at a time at rest permits the body to reduce oxygen delivery efficiency. And individuals with failed carbon dioxide breathing reflexes can stop breathing if they get too much oxygen, but this only happens at rest. Ardenne's protocols are safe because oxygen use is limited to 15 minutes, which is well below 12 hours. Therapy is short and strenuous and does not allow the body to adapt to high oxygen levels. And most importantly, therapy fixes the damage to carbon dioxide breathing reflexes by increasing carbon dioxide. Be reasonable. Don't hurt yourself. Therapy is exercise, so all of the cautions and risks of exercise apply. Oxygen will make your exercise seem easier, and you will naturally exert more. If you don't exercise regularly, easy does it. We suggest that if you don't exercise regularly, to exercise without oxygen the first time, and then limit your exercise to that level with oxygen. Continue this until you're totally comfortable that the increased exertion with oxygen will not be harmful to you. An aneurysm is a structurally weakened area of a blood vessel. Rupture occurs when blood pressure exceeds the structural strength and the vessel ruptures. The size of the vessel, rupture size, downstream tissue, and clotting factors determine the severity. Vessel weakness that leads to aneurysm is the result of degeneration, which is caused by oxygen and nutrient deficiency. So while healthy plasma oxygen levels protect arteries, foolish aggression that leads to too much vascular pressure in weakened vessels can cause disaster. If you've had long-term sedentary lifestyle or suspect vascular disease, start easy. Start with a low-stress therapy like Ardenne's 36-hour cure to gently restore your vascular system with only mild exertion. Then see a doctor to evaluate your ability to exercise. Movies dramatize oxygen as a fire hazard for entertainment. This is untrue. Oxygen by itself is not flammable and will not ignite or burn. On the other hand, if you mix oxygen with fuel like propane or flammable dust, the combination will explode much more violently than with just air. Ardenne's protocols use extra oxygen to restart the body's controlled combustion process. Muscles that get extra oxygen are immediately stronger, and this can create a strength imbalance during early training. When muscle is stronger than tendons and ligaments, exertion can strain them. Connective tissue takes a few sessions to catch up with muscles spiked with oxygen. So when you do oxygen-powered strength training, limit your exertion to normal levels for the first few sessions to build up that connective tissue. Aerobic training, where force is identical to normal workouts, does not have this issue. This effect enables a new kind of training that builds connective tissue. So if you practice a sport where you're vulnerable to sprains, contact us for connective tissue building protocols, and these will increase your resistance to sprain injuries.